Hi, my name is Dr. Nicholas Hartog, and I am an immunologist at Helen DeVos Children's Hospital in Grand Rapids, Michigan. So today we're going to talk about APDS and how people can develop it, and we're going to talk about the rare disorder and the importance of making a diagnosis. So APDS is a genetic immunologic disorder. It is quite a rare disorder, but making the diagnosis really can change the course of treatment for people. When I say it's a genetic disorder, what I mean is you're born with genes, and one gene will come from your mom and one gene will come from your dad in every cell. What these genes do is they then make proteins, and these proteins decide who you are. They decide how your immune system works, what color hair you have, all of the above. When somebody has a mistake in one of the genes, sometimes it's tolerated and sometimes it's not a big deal. In other situations, it can cause very serious diseases. Even small problems in a gene can cause a serious disease. APDS is one such of these situations. When you have a diagnosis of APDS, you have proteins in your body, and these proteins are going to tell your immune system how to work. There are times in some diseases where if you have one protein that's dysfunctional, it's okay. However, in APDS, you only need one bad protein, and then that one bad protein is enough to cause the disease. Diseases like that we call autosomal dominant diseases. In these diseases, you can either inherit one bad copy from your mom or one bad copy from your dad, or we can also have something that's called a de novo mutation. And that de novo means you're the first person to have it, and it developed in utero. With this, there often are multiple other family members that can be affected. And in addition, if you have it, there's at least a 50% chance of passing it down to any children you have. APDS is a disease that you're born with. It's not something that you catch later in life. It's not something that you develop. You can develop additional symptoms as life goes on, but it is something that you're born with, and the gene was set as a baby for you. With APDS being a genetic condition, there definitely is a chance that other family members may have this condition. With that, once a patient is diagnosed, we definitely do recommend that all immediate family members are tested to be able to make sure that they do not also have the same disease, because it really is not all that common that it's just one patient in the family. And these affected family members may have a variety of symptoms that may look like yours or may look a little different than yours. There are many different things that can really trigger a doctor to think about APDS, but in the end, there's really only one way to make a diagnosis, and that's by genetic testing. And this is actually looking at the APDS gene and saying, are there any problems in it that's going to make the protein not work? This testing can be really complicated, and it can really be difficult to interpret. And so for that reason, it is really important for any genetic testing to be able to work with a physician or genetic counselor to be able to walk you through what that testing means and whether there are any problems with it or not. By getting genetic testing and getting a diagnosis of APDS, it really can change your diagnosis sometimes. Oftentimes people may have multiple other diagnoses where APDS is really the overarching disease that's driving everything. Once we know that overarching disease, there are definitely situations where this really changes the therapy, the approach to the disease, and how we think about a patient and how we think about treating them. One thing that's clear from APDS is that early identification can lead to early guided treatment and really improve the care of these patients.